Hello, everyone. Good morning, good afternoon, and good evening, depending on where in the world you're calling in from. I appreciate you calling in and listening to this Medical Tourism Association and Global Benefits Association webcast. Today's presentation is attracting patients from the Middle East and GCC region, and I'm very excited to be, hosting this webcast with you today with an industry expert and a very good friend, Dr. Saif, who is Vice President of Government Relations for the Middle East and Africa with Aetna. And he's going to discuss patient demographics, market trends, sought-after procedures, targeted destinations, and the patient decision-making process that enters into planning medical treatments abroad for people from the Middle East and GCC. Also going to delve a little bit into why Middle Eastern and GCC patients are traveling for medical care, where they're going and why, the rise in chronic health conditions and non-communicable diseases, what the future holds, how to access payer systems in these regions, and what the best practices are for patient management. I think we all know the Middle East and GCC is a huge market of patients going outbound, and that we also know they're investing heavily in healthcare quality and in their own health infrastructure to not only keep patients within the Middle East and GCC, but to also bring patients in. So excited for this presentation. This webcast will be available probably within 48 hours. We'll be combining the video and the PowerPoints together so you can watch it or share it with colleagues. So you will get a copy of it. And at the end of the presentation, we'll be taking questions and answers. And at any time, feel free during the webcast to type in your question in the question box. And with that, I would like to turn the presentation over to Dr. Saif.
Thank you, Jonathan. And again, welcome to this broadcast. I'm truly excited to have this session as an interactive. I'll talk about a little bit, just to introduce the region and some definitions, then we'll go into learning points that Jonathan and his team have laid out for me. And then we'll close with a conclusion. Then we'll take up your questions, and myself and Jonathan will answer them. So let's go with the slides. So let me first talk about Middle East, and if you can see through the slides, Middle East is centrally located, and when we use the term Middle East, it's a group of countries, 17 countries that share the same location, as you can see in the map, culture and history. I would say probably not the same language, but all to an extent the same religion. And we keep using the term Middle East. However, what I wanted to introduce another term, this is another slide that shows you some of the Middle Eastern countries with their flags, just so it can be more familiar. And then we have another term that's the Middle East and North Africa. And I would say the majority of corporates in this world which operates in this region, they focus on Middle East and North Africa. And the reason, another term is called also the Arab world. And as you see, it's a group of countries also share the same geography, but language, religion, history, and culture. And it would become easier, to focus on those countries because you will be operating in one language. Between the two, we're talking like, 400 millions to 360 millions. I think from a business perspective, the GCC makes more sense, and I think it's the focus of this discussion today. The Cooperative Council of Arab State of the Gulf, or in other terms GCC, or the Gulf Cooperative Council, is a group of 6 countries that, again, as you've seen in this small map, the neighboring countries, they speak the same language, the same religion, the same culture, the same history, but also to an extent the same GDP, the same spending, and also the demography of population. As you may know, the GCC, the nationals constitute a lower percentage while they are heavily dependent on expatriates. So with that, what I wanted to introduce, those three terms that most probably you can find all the answers in Google or Ask. But it's very important that you know the region. Once you know the region, you can think about how to attract patients and from which country or which segment. And again, to talk about the region, so I thought that I'll share with you my views about the market. And in the Middle East GCC market, you have countries that are specifically, I would say, source for patients, like the Kingdom, KSA, Kuwait, Libya, Iraq, and there are countries which are providers or destinations, and the top 10 medical tourism destinations, like Turkey when we talk about the greater Middle East, Iran to an extent, Jordan, one of the biggest or the largest destinations for the region, Lebanon, etc. And with the health reforms, or I'd say towards the end of my presentation, I'll be talking about what's happening in terms of health reforms and government initiative. You will find few of those countries are moving into the direction of having both. So they will continue to be a source of patient, but at the same time try to attract regional patients. So we'll talk now about the patients and the patient from the Middle East / GCC. What I thought it would be useful if I introduce you to the segments of patients from the Arab countries. And those would be, as you see in this slide, the nationals. And the nationals constitute between 10 to 50%, depends on the country. So in a country like the Kingdom, Saudi, nationals are the majority. While in other countries like Qatar, Kuwait, or Emirates, or Oman, they are between 10 to 20%. It's also important to know that access to healthcare is a constitutional right. So whether the government wants to introduce reforms or not, they will have to take care of their nationals, and they will have to take care of their nationals' treatment in the country and out of the country. And this is very important for today's discussion. Then we'll look at the other 80 to 50% of population in the GCC, and those are expatriates. 10 to 20, and another 10 to 20% are from neighboring Arab countries. So where I live now in Dubai, we have people from Lebanon, Iraq, Syria, etc., and they all live here. They're still considered as an expat, and the government doesn't take care of them. However, they are potential market. And then we have, in addition to Arab expats, we have Asian expats, and those are more the majority, and to a lesser extent, Westerners, less than 5%. If I want to summarize the segment, so I will say there is a 10 to 20% average nationals, and those are the responsibility of the government, and then you have expats. And expats depends on where they come from, whether they are Arabs, Asians, Europeans. They will have a different thought process and funding source for treatment. Within expats, the majority, especially in those countries where there are a lot of construction projects going on, or oil feed, oil and gas industry, they are what's defined here as a blue-collar, low-income expats. Again, on the demography, it's worth to mention more than 50% of the population will be young males, fit to work. So, the points of discussion, and it's like in every slide there is a couple of points. So what I'll do, I'll read through the point and then try to answer it from my knowledge and experience. The reason that Middle Eastern and GCC patients are traveling are different, and they are different if I go back to the same segmentation which I did. So you have the nationals whom are covered by their governments. They travel in the majority of cases for surgeries or medical conditions which are not available within the country, and it's the responsibility of their government to send them to a destination and cover the treatment cost as well as the travel cost. However, expats living in those countries, they would travel primarily to their home country, could be for anything, from major surgeries to even a follow-up or a checkup. Believe it or not, some of them still retain a relationship with a physician in home country, and they go frequently, I would say every 3 to 4 months, for refill of medication. So why they travel could vary from, going there for serious surgeries, into rehab, to an executive checkup, to even a follow-up for a chronic condition like diabetes or heart failure or heart condition. And the destination would also vary, because if you're sent by your government or sent by a private payer, then you as a patient don't have much to say. However, when you travel by your own and you're covering the cost, so I would say the majority would travel to their home countries. And where India, let's say, would be the home country for the majority of people living in the region, they would go to India. However, and I think with the maturity of medical tourism industry and all the good work that's happening, and what MTA is doing, and with the conference and the knowledge about destination, there's a slight shift where people from, let's say, Jordan might travel to Germany for treatment, or patients from Iraq living in Dubai could go to Turkey, and etc. So here it's a very dynamic area. The rise in chronic conditions and non-communicable diseases has impacted the travel, and I would say now we have more complication that is very difficult for the existing health setup to handle. And I will add to it with the development in technology, so patients are not happy with what's the presence over here. They always want to get the best and the latest treatment. And in addition to that now, which is still developing, but many are thinking about checkups, executive checkups. They keep traveling just to check. And I would say like a destination like Singapore are doing extremely well, Malaysia, as well as Dubai is trying to be a center for checkups. I've been trying to refer to the future. The industry is changing, and I would say the changes are driven with the focus on cost and quality. So no longer payers, whether they are government or private, they have to use the facilities within the country. They always look at facilities in neighboring countries, and I would share with you one of the experiences that I had running a local insurance company where we used medical tourism as a cost-cutting and quality edit. How to access payers? I think identifying the segment you want to focus, as well as who's paying for this segment. So whether it's the government, you will need to present to the government, and you can do it by flying to every single country and meeting the government officials and making a case, which I would assume would be difficult and not very cost effective, or going to events or seminars where you will meet those buyers and try to promote your destination or hospital. The best practice for patient management is the end-to-end solution. And I can share with you a few of my experiences here, where as a payer, we always tend to work with an organization that promotes a destination which is well known to the patient, has accredited hospitals, but also can provide addition to the treatment and make the patient journey easier. And I would say the reflection, if my patients are happy, it's easier to pay on time. And I think dealing with one entity, so whether it's a medical tourism facilitator or a government agency like in Jordan, or even a hospital like some of the hospitals in the United States or in Turkey or in India, where you just deal with one entity and they will take care of the patient from the airport, even follow through with the post-surgical consultations and etc., makes it the best practice. And I would say payers, whether they are government or private, they don't mind paying extra for having this end-to-end solution. From overview to more of a broader topic is the procedures and the complexity of the demography. As I keep repeating myself, saying that we have different segments. So even the medical procedures that patients are traveling for are different. So while the government pays for complex surgical procedures or medical conditions that the local healthcare providers are not able to provide or to serve the population. The medical procedures, now we're talking about complex cardiac surgery, replacements, etc., etc. While when the same locals, he wants to travel for, let's say, cosmetic surgery, where the government doesn't pay it, so he would pick and choose different kind of destination. The same applies about expats. So today, with and as Jonathan talked initially at the beginning of the session, there are dynamic changes in healthcare with a focus on quality and accreditation, which makes it less and less for patients to travel for simple treatment. So, follow-up, consultations, simple surgeries. The number of those surgeries happening inside those countries are increasing, while still complex surgeries and I would say things like cancer, cardiac, ortho, not necessarily for cost, but because it's not available or the surgeon doesn't have much of experience handling it. The cost that they typically pay depends. So when we talk about nationals, again, we're saying that they don't pay for anything. The government takes care of it. So when they make a decision to travel, and the government, again, is paying for their travels, there is no much scope for how much and is it cost effective or not. Here you have to go back to the funding source. And normally those governments or private payers, they take cost into consideration and they compare how much this surgery cost in the country, or even if it's a government entity, how much this technology would cost if we bring it back. So when we talk about gamma knife, let's say, for example, in case of surgery, governments normally would evaluate bringing this technology and the surgeon and the training in-house versus sending those patients. When we say it's how much the price difference between, let's say, destination versus home country, always there's an advantage about going to home countries. And I noticed that, again, from the experience with expatriate patients who would go back to their home country, whether it's in the region or out of the region, even in Europe, although it might cost them more, even if the out-of-pocket expenses is more, because they have more or less, I would say, other factors to look into, like family members, knowing the doctors, or knowing the facility. With that, I'll move to another learning point and a discussion about the destinations itself. So as you see, some of the learning points repeat itself, but here, how they choose the countries. And that brings me back to the segments. So I will now look into the patients as they are government paid or government sponsored patients, or those who are covered by private payers. And the third segment is out of pocket. And governments tend to contract with destinations, not providers. So initially what they would think about, for example, when South Korea promoted heavily their services and became, I would say, one of the emerging medical tourism destination, what the country then do, try to promote it internally to the patient who needs travel or who needs to travel for surgeries or medical procedures. And that doesn't leave much space for the patients to choose. So what happens with the government-sponsored patient, there is a committee in each government, and they call it treatment abroad, medical committee, and they will evaluate the patient file. And in some situation, they might ask that the patient gets a medical record or a referral letter from a public hospital saying that this condition cannot be treated. They could also put recommendations saying like the best, I would say, destination or the best facility so-and-so. However, as the government pays, so they would most probably have contracts, and those are annual contracts with destinations. And as some of you are expert in this field, they know some of those discounts are linked to volumes. So they will have an incentive to send more patients to the same destination. The scenario with private payers, like health insurance company, who are large health insurance company, or even small ones, it would be very much the same. They would contract hospitals And and those hospitals should be in destinations where either they do business or they have a number of patients who would want to travel. So what we do here in the region, we normally contract with hospitals in Jordan, in Turkey, in Lebanon, because we know whether we have business in those countries or not, some of our patients would want to travel there for treatment. And then the choices for the patient to choose from the hospitals and the network. So I would say patients who are private health insurance coverage, they have more choices than those sent by the government. However, as you all know, not necessarily the private health insurer would pay for travel expenses, or they would pay for the accompanying family members. That's something that the government pays generously for. Out-of-pocket patients, I would say in 90% of the situation they will travel to their home country if it's nearby and treatment is available. If it's not, they will pick up the regional destinations. They won't travel to far destinations. And that would be the existing destinations that the region sent patient to, and I'm talking about that, the three, whether it's out of pocket, whether they're sent by their governments, or even if they're sent by private insurance. So historically, it used to be the United States and the UK, the Kingdom. However, that changed in the last 10, 15 years, where another tier of high-end destination, like Germany and France, came to the picture. And still, although some of those countries themselves are potentials for medical tourism destination, but there is a number of patients traveling from the region every year, and I would say that constitutes one of the largest chunk of the spending on medical tourism or patient travel. And that varies from a country to a country, but still I would say the United States is number one. And some of the statistics, or at least the patient survey would show you that if patients has the choice, they would go to the US. The emerging countries are, so to add to it, in addition to this tier one, the tier two still continues to be Jordan and Lebanon in the region. Jordan, for many factors, it's the accreditation of the hospitals, the travel time, the culture, and I would say a very important role in Jordan is the end-to-end solution in addition to the language. Lebanon historically is known as one of the best destinations in this region, but cost, I think, made Jordan favorable. The emerging destination in the region is Turkey, as you all know. They are working a lot on solving the language barriers and the end-to-end solution. However, it's still not a top destination for patients from the Middle East. It's working very well for patients from Libya, Yemen, Iraq, but patients from the GCC countries where cost is not a big issue. It's more of the convenience of the patient and their families. It's more of, or less, is the tourism experience that comes with it. Makes Turkey still an emerging market that taking a larger market share, but in GCC I would say not doing as good as I would say in other Middle Eastern countries, especially neighboring Middle Eastern countries. And sometimes it depends. So if I move out of GCC and focus on countries like Iraq and Syria and etc., Iran could be one of the destinations because it's the cost-effective and low travel cost, and most of the cases no visa required. The third point is a bit sensitive, but there were a few countries where patients travel and they stopped, and I would say that's primarily talking about governments and patients, because as I said and I repeated a few times, the government send patients to destination and hospitals where they have contracts, and those contracts has been reviewed annually, and I think they will continue to do. So sometimes when you see government sending patients to destination A, in a year or two they might stop because either they get a better deal, not necessarily the destination is not doing well, but they might get a better deal from another destination, or they do not agree on some of the I would say pricing or etc. or services, or to an extent what I generally say, I think it's the main reason that some of the destinations come up as an emerging, and in a year or two you see less number of patients traveling, is the new emerging destination. So while Jordan was, let's say, taking 90–95% of this market, when Turkey come to the picture, they are almost on the same travel time, similar culture, and etc. They competed and they took a share of let's say, of Jordan. While those who used to travel to India or to Malaysia or Thailand, they continued. Another destination for this region, which was popular for some time, is South Korea, talking about the technology and the end-to-end solution. However, we had hopes that this becomes the #1 destination, but for a reason or another, it didn't work very well. So I would say the destination was one of the most difficult discussion points, having the complexity of who pays for what and etc. The decision-making process, I think it's a good learning point. So I always go back to my segments. The government sent patients, although I might, exaggerate and made it like they don't have a choice. However, some of them, they come and they push for a destination, either because they want to continue the treatment. So let's say if you've been traveling to Thailand for years and you want to continue your treatment, whether the government still have good relation with Thailand or not, they would send you because they want you to have the same file with the same facility. The same apply when sometimes the patient come up with a treatment plan. So they have the booking, they have the surgeon name, and they go to the government and they keep, that's in the minority of cases, but the patient or their family sometimes are persistent. They want this facility in this country. And that's either because they've been into this facility in the past or one of their family, or because this facility came highly recommended. And in a high percentage of the cases, if they are persistent enough, the government will send them. When it comes to patients that are covered by insurance companies, so the situation is slightly different. If the hospital is in the network, then it's easy. They just pick the hospital and go. If it's not, they still can go to the destination and get the treatment at the facility of their choice with the doctor that they think he or she is the best for their condition. And if the insurance company, for example, did not have a contract with this facility and is not willing to have a contract, they can pay and get the money reimbursed. And that reimbursement could be 80%, could be 60%, could be 50%. But I've seen a number of cases where patients are persistent and they want to have the treatment in the facility, although they know that the full cost will not be covered. And depends on whether you are an Arab living here or you are a Western. So the way that you will find facility is different. I would say in my region, in my culture, it's more or less the word of mouth, which makes it a little bit difficult to promote a destination, and that destination, let's say, will be the leading in a short time, because there is a lab of experience. You need some patients to go there and they come recommending the destination before you want to travel. Internet is very important, however, it's tricky. It depends on if the website of the facility speaks the language of the patient, or as in some instance where there is a destination website, not a facility website. You can go and find videos, testimonials, and etc. And in most of the cases, those destination websites are in different languages, including the regional languages that we have. Cultural preference is very, very important. However, I think with the help of MTA and the certification program, now it's not a concern. You get patients traveling to Germany or the US and they can eat halal food, and there is no much of concerns about religion or culturally sensitive issues. The decision process about the patient, as I commented earlier, is if he goes through the government, so the government will give them suggestions, and normally what they would do, they will consult their local doctors to ask about the destination or the facility. And it depends on the level of education that the patient has or his relatives. They might go and even search the facility, the feedback of patients, the doctors. What's now it's been common if they know if it's a JCI accredited facility, so it's easier to make a decision. But I would say the majority of nationals, once the government will designate a hospital, they would depend on the word of mouth, and they will try to find out previous patient who had experience in those facilities and check what was their feedback. The decision-making process, if you have a private insurance, it's more or less at the end of, it's decided by your policy. There are some flexibilities, but in most of the cases, a policy is a policy. So whether you chose your destination, you talk to your insurance, whether they will approve it or not, you'll continue going forward to your destination, and most of the cases, bear the co-payor, etc. The out-of-pocket, I would say, it depends a lot about if you have a local presence or a local facilitator. And I'm talking about the majority of patients who are in the region. They'd rather see a physically see a person or go to an office and share with them their reports rather than just faxing papers or sending them online. I'm not saying it's not happening, it does, but it works better when you have an agency that facilitates the travel. And if this agency happens to be in the country or in the city, it's even easier. How long it takes, that depends on the condition, not necessarily depends on who's paying for what. So if, sometimes they move patients from a hospital to a hospital, they fly them. And those are very quick decision making. I'd say in the majority of the cases, the decision making is not very long. There are not much of concerns about the funds, which makes it easier. So it's more or less you have, let's say, 2 or 3 destinations you're thinking about, and then you find the facility. I don't know if it's unfortunate or fortunate, but in most of the cases, we're talking about the destination, not the facility itself. So if it's the best facility in a country which is not known for medical tourism or not very well equipped to receive patients from a different culture or who speaks a different language, even if this is a top-rated facility, let's say an American facility built in a country which is not known for medical tourism, it won't work very well. So I keep talking about the destination before talking about the facility itself. And that helps with the decision-making. It makes it more complex if the patient is traveling to a place or to see a doctor or a physician in a country or a facility that he or his family or his network are not very familiar with. Sorry, I passed about the trip, which is a very important point. Remember, we're talking about travel in addition to the treatment. And for a combination of facts, one of them is, you're traveling, you're taking a family member, and most of those destinations are not, geographically nearby. You need to fly for the zone of 4 hours or more. They have a different religion. Cultural sensitivity may or may not be a common knowledge. So the trip is important, sometimes not only for the patients, for the family. And I would say that plays a major role for patients who are covered by the government. Because when they travel, not only the patient, but his family members will also be covered. And then that takes you from you're just going for a surgery to that you're going to a surgery and you're spending a few days. And when you're spending a few days, if you're traveling with few members of your family, where is the destination, and if there is any things to do while you are there makes a lot of sense. That doesn't apply when the patient paying himself, because normally they would tend to travel to a place where they have family members or it's their home country. And the trip also becomes important if the facilitator can provide the end-to-end. And in some situations, the end-to-end heavily depends on the visa requirement. So as we all know, one of the reasons I would say, patients from the GCCs sponsored by their governments where money was not an issue. They start looking for other destinations where visa, travel or medical visa to Europe and the US became a little bit inconvenient in terms of time and process. You know, when you have a patient and you want to fly him immediately or as soon as possible, just running around and doing paperwork is not the best thing, or I would say is truly uncomfortable. You'd rather go to a destination where visa is not an issue, or visa is facilitated through the hospital or the agency. The second point is if they use a medical tourism or a doctor or communicate directly with the hospital. I would say there is a tendency to use both. So while even if there is a facilitator, you know, a lot they would try to go to the hospital direct, but they end up using a facilitator. And from a personal experience, and we try doing both, especially when the facilitator is paid from the hospital, it's way easier and very convenient to work with a facilitator. And whether this facilitator is I would say like an office related to the hospital itself or an agency, and this agency could be in the country where the patient is or the funding source, or it's an agency that is well established and known and reputable in the destination. And the reason I'm focused about the quality of the facility, because there are some destinations where there's a number of middlemen and facilitators. However, with time and experience, you find some of them are not, not, I would say, a professional. They are more or less like agents or brokers, and they work with a number of hospitals. And in case something goes wrong, or if you need to transfer money, it's a bit difficult. Is there any communication between the patient doctors at home and the international hospital or doctor? That's an area of development, I would say. And when I will reach to the conclusion points, it's something very, very important if you want to build a word of mouth, if you want to build a reputation. Because what would happen if the patient travels and then he goes back to home country, and let's say he consults a doctor for the post-surgical, I don't know, whether it's a follow-up or a complication or even concerns, and there was no proper communication between both the surgeon in country, and sometimes, and it depends on the surgeon's, I would say, experience or education, he might disagree with the initial surgery. It doesn't mean that the previous, or I mean, the surgery which happened in India or in Turkey or in the United States is bad. It's just disagreement. And unfortunately, that might be perceived as the surgery was bad and this destination or this hospital or even the doctor was not good or not at the level. So the communication would work very well. However, it's an area that I would say needs a lot of work, not because the facilities at the destination are now willing to, but more or less the patient in country are not very cooperative. I found a beautiful example in Iraq, my home country, where the doctors work directly with hospitals overseas, and then they become kind of like their referral points. And then once the patient is back, they also work through the same doctor, and that system worked very well. It also makes it easier to trust the provider at the other end, because your physician, who is from your city, who knows you, who knows your condition, is referring you to that destination. I don't have experience building that network, but I think it's more difficult, and it could be cost in terms of time and money to build relationship directly with physicians and turn them to be your referral points. The transmission of medical record is still another area that needs a lot of work. However, it's not as important as building the referral. It's still mainly the papers, the electronic documents. I mean, like things like having a CD with your MRI or CT, obviously it is the trend, but having the whole record on a USB or online, it's still, because we don't have electronic health records, or even if we do, it's more or less like a hospital management system. So your records are in your hospital, and it's not transferable. The types of services the healthcare consumers require in the form. This is I think, a very, very important point. for the destination. If you provide end-to-end, and the definition of this end-to-end, and I would say that also depends on the segments of the patient. So while nationals sent by their government, they expect you to meet them at the airport. In fact, even before that, they expect you to communicate with them, facilitate their visa, ask about where they want to stay, preferably if you have, the whole solution before they go, so they know where they are staying. I've seen some of the providers, even they give them a mobile number, etc. And that goes through the treatment, coming up with, I would say, practical solutions or options for relatives, whether they can do a checkup while their father or mother is doing a surgery, whether there is a shopping trips or tours, etc. The more you focus on the tourism, it makes it easier and more popular as a destination. Given that we're all talking about the patient expect that this facility is accredited, the physician has a certain level of training and etc. And when the patient are traveling through his government, he would assume that the medical committee at the government, before signing the contract with the facility, have done a due diligence. So they don't care much about Googling the surgeon's past experience or qualifications. They count on their government. At the same time, this happened to an extent for patients who are sent by their insurance, because as an insurance company, you have to do your own due diligence before signing contracts with hospitals. You have to check the license of the physicians, the accreditation, and etc. Those traveling and paying themselves might be more painful because they will have to do the research on both ends about the trip itself and also about the facility and the physician. So the last learning point is about the payment, and here there is a mix. So even when the patient is a government sent and government sponsored, in some of the destinations or the hospitals, the government has an open account where they keep sending patients, and then they pay on quarterly or yearly basis. However, this doesn't apply, I would say, for specialized centers. Some of them, they require the payment to be upfront, even if you are sent by the government and you have government guarantees and the embassy can facilitate that, they still ask for the payment to be 90% or 100% fully paid before the patient reaches the hospital. The other mode of payments, when we're talking about an insurance company sending patients, as normal, it goes through the claim processing. So you will need to have the proper contract in place, and depends on what your contract says, you'll get reimbursed whether 3 months or 6 months or. However, again, I would say it depends on the facility, but some of the facilities would require a guarantee of payment or even a fraction of the payment to be paid in the front. What's not very convenient, and I would say makes the patient not very happy with experience, when you are sent by your government or you have a health insurance that guarantees the payment, but still the hospital asks for a guarantee from the patient. And it depends on the surgery or the credit card limit. Some of those patients cannot do that. And they reach out to their government, or like if we're talking about GCC countries, so in most of the cases they would go to the embassy and have the embassy helping them. And I would say they normally, and I think they have all the right, but that kind of changed their experience. Although it could be a genuine right of the hospital to guarantee the payment, but there might be other ways of doing it, like communicating directly with the funding source, or explaining to the patient in more details that he has to be financially prepared and that he needs to pay up front, or etc. So this is more or less something not in the learning points, but it's worth to share with you that the whole GCC, although we all know rich nations dependent on oil, however, there is something called the GCC Council of Health Ministers, and in 2012 they started the discussion going through 2013, where they announced that health funding is the new agenda, where they're looking at solutions or initiative that will help them to secure funds for health, again focusing on the same points. They want health to be accessible for all with a high quality, and it has to be also affordable, but the government cannot continue to spend on health the same way they are doing. Given that, and some of the research MTA has done, and then what we hear in conferences, still there is a number of patients who are willing to travel because you cannot get all of those surgeons and all of those names and accreditation and technology in the country. So one of the, I would say, the successful models where government in this region has to take care of their nationals, what they are doing is they are pushing some of the responsibility to employers by introducing, for example, mandatory health insurance. So in the Emirates, where I am right now, in the Emirate of Abu Dhabi, there is a mandatory health insurance where everyone is insured through a private company. And Dubai is thinking about the same. Qatar just did that with Aetna, where we're doing the mandatory health insurance for all. Iraq is thinking about it. Syria has a program. Saudi has a mandatory health insurance scheme for all expats, and now they're thinking about their nationals. So moving forward, who's paying for the patient treatment won't be a concern. Everyone will have a funding source. So every patient will have a card, like a credit card, and he can get the treatment where he wants to, which will drive competition, and maybe, most probably, that would be a good option for tourism, medical tourism destination and facilities, because if the patient doesn't pay for his treatment, it becomes easier to target those patients. And you don't have to go through the government or, make, let's say, contracts with the government. You can just promote their destination to the patients. However, what's the other point that the government is looking at is a longer-term vision with the health PPPs. And for those of you who know about the region, Turkey did that very successfully by partnering with big hospital groups to build their own infrastructure, and that helped them to become a destination. Abu Dhabi just did that with top destinations. And others, they are looking at this model as a solution. They don't want to continue paying for treatment overseas, but they are looking at more strategic initiative where they bring those overseas destinations, or in fact hospitals or brands, and they have them either open a facility or affiliate some of their facilities. So they found just having an accreditation, JCI accreditation or local accreditation, is not enough. They need to do more. And if they find that their patients are traveling to Germany or to the US, they are trying to bring in those German and US facilities to either operate or to work with the existing or to build their own. That definitely will have a big impact on those markets, and players who think strategically most probably will take a big share of this market if they have a local presence. The licensing and regulation is changing also, where we're moving to a more standardized care and pathways and very, I would say, internationally benchmarked regulatory frameworks, where this in the future might change the perception about availing health services here in the region. With that, and before I move to John, is my conclusion, I would say for those listening to me today, just have a more of a long-term. I keep hearing the discussion on the events that we go. Destination sort of facilities are looking at brokers or those who send patients with a referral percentage. I don't think this will continue to work. You need to build a winning strategy. You need to focus on your segment, whether you want to work with patients sent by the governments or health insurance or those who pays cash. I truly believe that every one of them would need a different approach. You cannot have one approach for all of them. You cannot have referral points in the country for patients sent by the government. You need to talk to the governments. If you want to target health insurance, it's easier. You go to those events where you find those buyers and you talk to them and you sign contracts, and that's it. If you can, and that's more or less sharing, I would say, how Turkey did it, how Malaysia, or how Thailand, if you can talk as a destination rather than a facility, it will make your life easier. The local presence in many forms, whether having pre or post treatment, which is the best, or even having a local facility in in a form of a PPP with the government or even with a private investor, to even having a coordination office will help you a lot. Thank you very much. With that, I'll move to Jonathan.
Thank you, Saif. It was an excellent presentation, very thorough and detail-oriented. We're going to be taking some questions and answers in just a minute, and before that, I just want to run into a couple slides about the upcoming 6th World Medical Tourism Global Healthcare Congress, November 3rd through the 6th in Las Vegas. We're going to have about 2,000 attendees this year. We should actually have more because attendance is statistically goes up about 15 to 20% when events move to Las Vegas, and participation is up this year. We've got some really amazing speakers. We're going to have up to 200 exhibitors and about 90 to 100 countries participating, and I believe between 100 to 130 speakers. We have a VIP buyer program, so if any of you on the call are buyers of healthcare, you can go online to our website and apply for a free pass. We always pre-approved 400 buyers of healthcare for this year. This is a profile of where the buyers come for our conference from different parts of the world, about 19% from the Middle East, which is what Saif's presentation is on, but really from all 5 continents. We have a lot of summits this year. We've added some new ones. We have the Global Ministerial Summit with Ministers of Health and Tourism and Economic Development. We have a Global Medical Network Directors Summit this year with people from insurance companies in charge of contracting with hospitals. We have our Medical Directors Summit, and we just entered a multi-year partnership with Bupa, where they're going to be hosting their own international provider summit within our conference. And Bupa's, I believe, the largest health insurance company on an international basis. We have some industry forums this year that you can participate in, from the Medical Tourism Facilitator Forum, hospital forums. They're all on the website. I won't go into them in too much detail. And we really have some great sessions this year on buyers of healthcare, where we're going to have presentations from people from different regions of the world talking about buyers from that region. So we have the CEO of Clayos Healthcare from Kuwait talking about Middle Eastern patients at the conference. We have someone talking about Russian patients. That handsome gentleman at the bottom of the screen is Saif. He'll be presenting in person. So you'll be able to definitely, if you'd like to meet with Saif at the events and get some strategy or ideas for him. He's very smart and knows a lot of people all around the world. Other buyers of healthcare sessions: Canada, the CIS countries, Africa. We have a whole business development track this year about taking your medical tourism business from to the next level, from a New York Times best-selling author selling to the C-suite, to quality providers, to Dr. Kevin Foe, who's actually, I believe, the top social media doctor in the country with the most followers, very influential. You can come and attend and get certified. That's Wednesday, November 6th. You can spend all day, go through a training session, take an exam, and become a certified medical tourism specialist. And obviously, we'd love to have you as a member of the Medical Tourism Association, and we've just launched some new benefits, but there's a lot of different benefits of joining, from access to patient leads to business-to-business networking, and a 2-for-1 pass to the conference. So with that, I'd like to turn it over to questions. And so if you have any questions, please feel free to type your questions into the box. We'll try to answer as many as possible. Saif, one of the first questions that came in was, how does India become a destination for patients from the Middle East and GCC, and why are Middle Eastern and GCC patients not traveling to India now if they have quality and their pricing is more affordable?
Thank you. This is a very important question. And I would say that goes back to when I said there were tiers of providers. Patients travel. So like the U.S., patients travel to India because I would say the majority of expatriates healthcare workforce are Indians. And if you are treated here by a physician who used to work for 40s or any of the big Indian healthcare groups, much more that would develop knowledge about the practices over there. And historically, and it's still up to date, many of the hospitals, the local hospitals here, they don't have the full range of services. So the referral was not very structured, but patient used to travel to India to continue the treatment. And not only the treatment, India is a very popular destination. So it's a tourism before it becomes a medical tourism destination. And this continues, by the way. Patients who travel to India, they continue to travel. Now, what happened, there are new destinations that taking shares from the India market share, the previous market share. I'm not saying India is still trying, and I think in the last 2 years they had a few campaigns. Now they are back on track with conferences. They're trying to build their presence. However, other destinations were more aggressive to get those patients.
Thank you. That's a very good answer. And I think what we've seen here is that, as Saif said, there's a lot of destinations that have entered this market, and it's become very competitive. And we're seeing countries and destinations lose market share because they're not becoming as competitive, or they're not branding as much and raising consumer and business awareness of their medical services. And I think we definitely, I think, have seen that in India, because if you go back, like Saif said, years ago, India would be that really one of the top destinations in the world. But I know there's been a challenge getting the government to really support it, and there's a lot of talk about the government supporting it, but they're not very active in supporting it on an international basis. And so other destinations that have been very aggressive in their marketing have come and taken some of that business away from India, and I think that will continue to happen. So with that, Saif, I think that brings up a really great issue that I talk about a lot, and I definitely like your perspective, is how important is it in this industry for there to be really relationship development and face-to-face meetings and things like that? Because I think there's a lot of people who either get in the industry and they think they're going to email someone a brochure or pick up the phone on Skype and they're going to start sending them patients. And I think that we've seen a lot of business get lost by hospitals and destinations because maybe they initially got the business, but then they just focused on that, just communicating via email and phone.
Well, I will answer from a personal experience. As you know, Jonathan, I used to be more of a health official, and then I moved to the industry. And at both ends, I would say it reflects a level of unprofessionalism when someone just sends me an email and and like you think that will be sending you patients. It's a bit of a thorough process, and the more successful, I would say, destination or facilities are those who will be physically present in your office and present. However, for us, when we go to those events, like obviously I've been coming to the event every year, and it's a very good opportunity that you see the destination, you talk to them, not just get a brochure, you see how they interact with others and etc. And their presence over there reflects how much they are interested in attracting those patients. I mean, we know that there is a number of facilities that's very good, but as I said, when you send the patient to get his treatment out of the country, it's not about only the facility, it's the whole experience. It's the trip, it's the follow-up, and of course it's the cost. So I can't agree anymore. Now you're moving even into this focal groups and summits and forums, which helps to maximize, I would say, those face-to-face interaction, which leads to business.
Thank you. And here's another interesting question from Tinu, and I think it kind of follows up a little bit with what we were talking about. And they asked, how important is it for visual marketing or photography to sell healthcare consumers on a hospital or destination?
It's very, very important. So as it's important to use the language of the targeted group, if you can't do that, a photo or a video would deliver half of the message, So visuals are very important. And not only, I mean, if you want to invest more, and I've seen, it's very exciting that you have a panel about how to develop business and social media. It's very important, not what you say on your website, but what other websites says about your service. So those online forums, including even Facebook and et cetera, can help you a lot when you can just post a photo or put a video instead of put a write-up or an article. So
yeah, and I think with that, I think with that Saif too, I think that important thing would be if you're going to post that picture or video, make sure it's a high quality image.
Of course.
Yeah, because if you post something that isn't, let's say high definition, or it's poor quality picture and it's somewhat fuzzy, it can give the impression that your hospital or clinic may not have that infrastructure in place.
You are absolutely. It's as important as how much you spent on your physician's training and accreditation. It's your gate to the patient, and even to the governments, by the way. I mean, even those who are industry experts, and they should look at just qualification of physician. They look at your website. They look at your. You remember, I mean, we had similar discussions about the quality of videos, the patient experience, which is very important. When you bring in true patients and they talk about their experience, there's nothing better than that.
Someone asked, is it still worth targeting patients from the GCC region using search engine marketing? And I'm guessing they're talking about more of SEO or pay-per-click.
Well, I think that's a cost-effective module, but if I have any budget, I would target it into a more focused initiative rather than just search engine. It's very difficult that if I want to travel, I wouldn't write like cardiac surgery India, for example, and then I'll pick up the first one. I'd rather do a thorough research. So even if you are not an SEO-friendly website, patient will find you if they hear the name or they've seen you somewhere, or the payer. If they have a contract with you and they recommend the hospital, that SEO is not a big deal.
And I know it's become a challenge on the SEO side because as more hospitals, facilitators are focused on SEO and the pay-per-click campaign, it gets very expensive. And then some companies are reselling those patient leads, but they're selling the same patient lead to 10, 20 different companies. So another interesting question that came up from Stephen, and he's in Cyprus. He asked, how can you find, as a clinic, a local partner for the GCC? And I think outside of Cyprus, it's a great question for anyone on the call, is, if you want that local partner to have a presence for you in that region, how do you go about doing that?
So remember, I mean, we talked about if you want to target patient or sign contracts, you have to meet them physically. I think it's the same, because the quality of your local partner will reflect the quality of your service. And again, if you just try to, let's say, mass email people who are in this country and use them as a referral point, it's different than what I said about physical presence. So for example, in the events, when let's say I'm in an event and there are providers from this region, you can talk to them and discuss this in a form, not necessarily in a deal on a percentage, but more of strategically, like in having a co-branded clinic, train their physicians, etc., etc. It would work more. I mean, it might be a bit expensive to find a local partner, but you can start with the search, and those who have quality could be your potential. So then you can communicate with them through emails and phones, and then much probably you will have to go and visit their site, and they will have also to come and visit. Otherwise, I was not meant to say that you find local facilities who tends to be your referral points. They have to be your kind of like partner or an affiliate. So they share part of the responsibility.
Thank you. We have a question from Joseph, and he's in Alabama, and he runs a sports medicine and joint replacement program. Working with orthopedic surgeons. So his question is, how does a hospital or clinic in the U.S., for example, try to attract international patients from the Middle East and GCC? I know you covered some of this, but if they have a great program in their country, but now they want to take it to the Middle East and GCC, how do they raise that awareness?
Well, when you have a specific product, it depends on, you'll have to go back to the segments and choose which segments you would want to work with or your product will make sense for. So, for example, it could much more it's the government. So you'll need either to meet the government officials at, let's say, the Ministerial Summit or similar summits, or you fly in and present. And I think they would be interested if you have a solution. And again, your product has to be an end-to-end. I know in terms of the surgeons and the surgeries it might be the best, but we're talking about from the time they receive, let's say the query until the time the patient is back home and he might have some issues about his surgery, or his physician needs to pull up a report. I think to start with is identify your segment, and based on segment you work with. It's very difficult to target patients. It's very, very difficult. You'd rather focus on either private health insurer, where, working with Jonathan and I worked on that, and now it becomes more or less a successful experience, and all private insurer are at least considering using medical tourism. And government has been using that for ages, so it's very easy to talk to.
Another question came up, and it was, do you think Middle East and GCC patients would go to Mexico? And I think also along that question, we can kind of equate that to any country. What is your thoughts on that? And I know from my own experience that, we're seeing Middle East and GCC patients travel all over the world. I was in Argentina a couple months ago, where they were getting some Middle Eastern patients.
Yes. Well, I think they will do. It depends on what you offer. If you can solve the issue with the travel, given that Mexico, for example, is one of the countries that has no issues with visas, so literally almost everyone can travel without a visa. It's just the traveling time is a bit not very convenient. However, you can excel in something like Brazil do, like in plastic surgery, or I don't know, dental or implants and etc., where patient can travel for hours. They're more or less traveling for health, not a medical necessity, which it's like a cardiac case or an ortho case or etc. And I think very well, they will travel, because if they travel to the U.S., they're almost in Mexico.
One question from Amin, and she asked, in your experience, Saif, what's the perception and image from the Middle East of Canada as both a medical destination, but also as an accreditation provider?
So was the question about Canada?
It's two questions. One is, what is the perception of Middle Eastern patients towards Canada as a healthcare destination?
Well, Canada is, and I think what built the reputation is there's a number of nationals who are trained in Canada, and they all believe in the system. The only concern when you think about sending private patients to Canada is it's pretty much like NHS. It's more or less a public system where the hospital, although it provides excellent service, but the customer component is a bit missing. I don't know if the private healthcare facilities in Canada are trying to attract patients from the region, and I think that would work very well, just like the U.S. But when you look at the Canadian system, the referral center, the tertiary, are public. And when we think about it, so it's just like sending a patient to a public hospital here. We know it's the best, but we cannot count a lot on the patient experience. What we talked about, the trip, the accommodation, the end-to-end service, the meeting at the airport. However, it's very easy to solve. Many hospitals, they work with a facilitator or a VIP service provider, and then that's it. You can have as much as patient as you want from Canada or from the Middle East. And did you ask about accreditation? Is that the Canadian accreditation you mean, or any accreditation in general?
Well, the second question they had is what is the view from the Middle East side of Canadian accreditation in the Middle East?
Yeah, well, it's more or less a JCI-driven market. Canadian accreditation is not very popular, and to be very, very transparent, some might choose to go for Canadian accreditation because either they don't like JCI, or JCI is very expensive for them, but I would say the benchmark is JCI.
Okay. It looks like that's all our questions. Is there anything else that you would want to cover, or any words of wisdom, Saif?
No, but I just want to repeat what you said. I'll be in Las Vegas, and I'll be very happy to to answer more questions, more specific questions, and even help you if you want to be referred to, let's say, depends on the segment you want and the business you are into. You can reach out to the email address. If you have any questions, the team will refer them back to me, and I'll get back to you with an answer.
I've got a very important question for you, Saif. What's your favorite part about Las Vegas?
Oh, that's difficult. You know, I would say the hotels.
So, okay, thank you so much for your time, Saif. It was a really great and in-depth presentation. Anyone has any questions, feel free to email us, and we'll make this presentation available. It'll probably be available by Monday, and hope to see everyone in Vegas, and I'll be seeing you soon in Vegas too, Saif.
Thank you, Jonathan.
Take care.
Bye-bye.